The growing measles outbreak in Texas has become Robert F. Kennedy Jr.'s first challenge since being appointed U.S. Health and Human Services Secretary. Last week, Kennedy appeared to downplay the situation by describing outbreaks as, quote, not unusual. Now he's advocating for the MMR vaccine. Joining us to discuss the situation is Will Humble. He is the executive director at the Arizona Public Health Association. Thanks for coming in, Will.
Good evening. Thanks.
In an op-ed that was published by Fox News just yesterday, Kennedy said vaccines not only protect individual children from measles, but contribute to community immunity. A different sort of spin or take or statement that we've heard on this. What do you think happened?
Well, it's very different from the things that he's been saying over the last 20 years. I'll say that. Those are spot-on talking points that we use in public health. That's just a tried and true method that the community. It's not just about individual protection; it's about community immunity. So, kudos to Mr. Kennedy for that statement. It's right on.
Secretary Kennedy says ending the outbreak is a top priority, and the department will send 2,000 doses of the vaccine to Texas. What kind of impact do you think that will have?
Well, that'll be helpful for those local health department folks who are doing the mass immunizations, maybe even some people from the state health department in Texas. I mean, when it comes to public health, the grunt work is really done by local public health, county health department folks. And so they need the resources and the training and the staff to be able to respond to outbreaks like this. And so the most useful thing that the federal government can do is to send resources like you discussed, the 2,000 doses of vaccine. But it's also helpful to have the proper narrative, which Mr. Kennedy, as of today, is spot on. A few days ago, he was saying things that were off target, but today it's better. So the messaging's important too, not just the resources.
Let's transition from measles to the flu vaccine. This is the time of year when experts are doing what? They're already talking about next year, right?
Right. So in our winter, they're having the summer down in the southern hemisphere. And so what epidemiologists do is look at the circulating strains of influenza in like Argentina and Brazil, in Australia, New Zealand. They look at that surveillance data and then decide, and with a prediction using, looking at the surveillance data, what should we include in the northern hemisphere influenza vaccine for our flu season, which is where we start getting vaccinated in October. So that's a really important meeting where you pick the exact strain that the manufacturers would then begin manufacturing so that we have the right vaccine matrix for the fall. Mr. Kennedy canceled that meeting. So that's a setback because you got to make that decision in March in order to have the vaccine available in October, because there's a long manufacturing period.
So that meeting that you just referenced that was canceled was set for March 13th, and that was the Vaccines and Related Biological Products Advisory Committee.
VRBAC. Yeah.
It is a mouthful. Okay, so here's the deal. Someone might say he's the new guy, so why wouldn't he want to make sure he knows who's on these committees and who's deciding what, and what's wrong with just taking some time to do that?
Right. So that's not just that committee, but there's also an ACIP, Advisory Committee for Immunization Practices, where Mr. Kennedy has said he's looking at who all the people are on these committees, and he's considering replacing some of them, and that's the prerogative of the secretary. By statute, by law, he can do that. I'm just hoping that he uses and he puts his thinking cap on and says, look, I'm going to put some talented people who use evidence to drive their decision making and put them on these committees. And it remains to be seen, what's going to happen. So I'm encouraged by the statement that came out today. Am I optimistic? Not yet.
In the past, Secretary Kennedy before he was secretary, I should say, criticized vaccine advisory committees for potential conflicts of interest and having undue influence from pharmaceutical companies. Any of that ring true to you?
It's always possible that there's conflicts of interest involved, and it's important to make sure that you don't have those conflicts of interest. I haven't seen any evidence of conflicts of interest on either of those committees, ACIP or VRBAC. We'll see if Mr. Kennedy identifies some people that he believes has conflicts, and it's okay to replace some of those people on the committee as long as you replace them with people who have the expertise that's needed to make good decisions.
So before he became secretary, he was a lawyer. I guess still is a lawyer. I don't know if you ever throw away that hat or not, but they're different roles, certainly. And we were talking a little bit about expectations or maybe your hopes and or fears about what will happen because he's in a different role now. What do you hope will happen?
I hope he surrounds himself with people that will emphasize the importance of using evidence to make policy decisions in all those agencies. I mean, he's in charge of, you said it at the top, 30% of the federal budget. The Centers for Disease Control, National Institutes of Health, Medicaid, Medicare, they regulate the marketplace plans, FDA. It's a huge responsibility. And if he doesn't surround himself with talented people who focus on evidence-based decision-making, we're in for a troubled 4 years.
On the health subject, we've got about 30 seconds left. Let's move on to, tell me a couple of things that you think he is doing well or will do well, that you like, or at least doesn't rub you the wrong way.
Well, there was one decision that was made about last week, and it's a little wonky and we don't have much time, but he released a drug called clozapine to make it more available to people with a serious mental illness. I agree with that decision. We've been trying to get that done for the last few years, so that's a good thing. He's also focused and has talked at length over the years about the importance of physical activity and nutrition and getting people healthier to prevent some of these chronic diseases. The big question is he going to emphasize evidence-based strategies to do that? Or is he going to fall back on what he has been doing over the last 20 years and just use whimsical ideas to drive policy? And so we'll see.
Will Humble, I suspect we will see you again chatting a little more about this topic. Thank you for coming in.
All right. Good evening. Thanks.